Good evening, friends. Welcome to this weekly edition of Miraculous Mondays. This is the penultimate episode, number 25. We wrap up the series with the first half of this year next week. Of course, this series has given me immense joy bringing new vital topics in front of you in the past 24 weeks. This is the 25th week, of course. So let's begin without much ado. I apologize for the due delay. I had joined back today only after a 7 day break. I was on a vacation, so I joined back today only. So there were a lot of patients which needed to be attended to in today. So allow me a minute to share my screen and then we can begin the proceedings after that. Let me just check also. Yes, we are live. Okay, let's begin the screen. I hope my screen is visible and I am audible also. Yes. Okay, guys. Welcome once again officially to this edition of Weekly Lives on a Miraculous Monday, happening on a wonderful Wednesday. This time, as I told you, I was traveling on Monday. For the past 7 days, I have been traveling. Joined back today morning only. So this is the penultimate episode, and we wrap up the series with the mega finale next week. Next week, the episode again takes place on a Tuesday, not on a Wednesday. Next week, both episodes will be on Tuesday and Wednesday. The Thunder Thursdays and the Miraculous Mondays. Because 27th is a event in my family, and 30th Thursday is my dad's anniversary, which is a mini education day. There will be 3 further webinars on that day, which I'll notify in tomorrow's session. So let's concentrate on today's session officially today. So, all as usual, all my presentations always begin with thanking the Lord Almighty who's given me much more than what I deserve. And this is my brief CV. You all are aware of by now. So, I was supposed to take marketing part 2 today, and maybe part 3 if at all the audience interest was there. But then when I was traveling, also I came across this news, and in the past 3 days, this has become the hottest trending topic. So, I've just shifted the priorities for a little while. And I mean, just for this episode, I mean to say. So marketing not two, but as a bonus, part 2 and part 3 both happen in the next week finale episode, which will be on Tuesday, 28th June instead of Monday. Because this will be again not a half an hour, or it will be an hour long special episode. It will be continued from part 1 of the month. So part 2 and part 3 also happen in the same episode. So today we are going to take up this topic. As most of you saw in my WhatsApp group that I put up the post, this is the hottest trending topic. Of course, we cannot just go into these two images. Even the images on the social media are a little bit diverse. One of them is showing the swelling on the left side. One of them is showing the swelling on the right side. So there have been multiple variations, but we all know what makeup can really do. So it is not only about the swelling, it is about the other change in texture and color skin. Of course, any racial bias side, I'm not going into that part. But just to tell let you know that what all can be done sometimes. So what is the topic for today? The topic for today is the actress Swathi Sathish root canal. This actress, the Kannada actress Swathi Sathish. So my topics for debate are: is the dentist really at fault? Is the actress really suffering? What is the real truth? And the debate begins. Of course, it is open for discussion for everyone. So this was the post which has been going rounds on various social media, particularly Twitter, particularly other things, other social media. And we all know the negativity and the bad news spread faster. And when any healthcare professional is involved, it spreads doubly faster. And people make a judgment. People start running their own courts. People run a social media trial. The media does its own game. And of course, the healthcare professionals do suffer. Fault or no fault, let the competent person decide. But before that, any person is made guilty in the eyes of anyone, we can say. So what is the brief story? Let me just give you both the versions, then analyze it, and of course, then further postmortem it whatever way we can. So the actress detailed about an episode which happened 23 days back. Today is 23rd of May. 23rd of June or 22nd of June, sorry. So this episode happened, it was divulged first on 20th of June, 2 days back, which happened 23 days back on 28th May. She went to Oryx Dental Multi-Speciality Dental Center run by Dr. Dhananjay Sanjay. And Satish, who had been suffering from swelling on the face, is now on her path to recover. And she said, even though I'm recovering, one thing is still there. I don't get my proper lips shape back. I can't smile perfectly. It's been 23 days that I don't have any sense in my lips. And as per her current doctors, which does it mean that she already has in a second or a third opinion already in place? It may take another 2 weeks or a month to get back. My root canal treatment isn't even completed because of the swelling current. Now, there are multiple theories which are doing the round here. Is it only a root canal procedure? It is a extrusion of LA or extrusion of hypo or any peroxide injection, salicylate injection which is being reported, or at all, it is a cosmetic procedure also because when salicylic acid is mentioned, it is used as a chemical peel used. So what exactly is, some things are not clear, but what majority opinion, public opinion or public news has been in there is that she went in for root canal treatment and probably because of her accident, it resulted in a big swelling. Can be allergic reaction, can be iatrogenic, can be pathogenic, can be cellulitis, can be facial infection, can be multiple things. But what exactly is the focus here? Let's shift to that. Now, Dr. Dhananjay Sanjay, he is the owner of Oryx Dental Care. He says that the actress has recovered almost fully. He says, I have videographic footage, which means CCTV footage with or without mic, we don't know. Must be with mic only if he's so confident. To prove that the swelling on her face is gone and she is doing completely fine right. That is what the old dentist claims. The photos that she has shared with the media are over 20 days old from the first or second day of the swelling. Now, the question here is not about the first or the second day of swelling, it is about certain things which happened in the past. As I said, she shared the photos after 23 days on 20th of June. So now the actress Swathi Sathish has alleged that Dr. Dhananjay's wife, Dr. Mayuri Sanjay, who treated the actor, she was negligent during the procedure. That is what her version is. And she has taken a second opinion in various news reports. It's been mentioned that when I consulted another dentist, this is what I found out. Now, this is the patient's version. The dentist who did my root canal first injected me with sodium hypochlorite, at which point I screamed and started crying because it was extremely painful. Later, she injected anesthesia. According to her current doctor, this should have been done the other way around. The anesthesia goes first and then the sodium hypochlorite. See, there are so many parameters involved in that. I'll be discussing that in the next section of legal analysis. The point is, we don't know what exactly happened. We can only make aspersions as per the stories reported because the patients don't know sometimes the full story. The dentist says he followed the proper protocol. Dr. Sanjay's version is we have videographic proof to show that the procedure was followed correctly and a local anesthetic was used before the sodium hypochlorite. Maybe it did not act. Maybe it was a hot tooth. Who knows? However, it may have been possible that at the time of injecting the sodium hypo, some may have spilled out onto the nearby soft tissues, which resulted in inflammation. Now, this one point automatically tells you that the rubber dam was not used. How many times we have maintained that even if it goes to we can say a dental board, they are going to hold the dentist guilty. And if you're doing a root canal, the rubber dam has to be the gold standard. It is the normal followed standard. So if he has himself mentioned spilling out to the nearby soft tissues, at least he is guilty on one count. He's never mentioned about the documentation part. He's mentioned the videographic proof. He's relying only on CCTV. So no mention of documentation, no mention of rubber dam. He's himself mentioned it may have spilled on. Now this kind of occurrence is quite common. This is Dr. Dhananjay Sanjay's version. Spillage onto tissues is absolutely normal. It is his version. It is not the commonly go-to opinion version. So he says, I am in the field for the past 5 years. I've seen such situations arise. 5 years is not a very big time to be called as a very experienced person in this regard. Our job is to know how to deal with it, and the right way to do is to make sure to take the right medications and antibiotics. I unfortunately don't agree with this point. If you are causing an injury and then you know how to deal with it by giving the right antibiotics and medication, I'm sorry, that is not the correct answer or the worst. He has a flimsy stand whenever it comes to those situations. We understand she may have been stressed or panicked at that moment, but we could not help her because she was not ready to accept our help. Why would she? Why would she? I started off with a question mark. Is the actress really suffering? Is the dentist really at fault? No words to say. There are a few things which are a little bit dodgy. Of course, this is the reported version. We don't know the exact version, but that is what we can make out from the statements given by both the parties. That is what we can make out. Now, he says she asked us to pay her 1 month worth of salary along with cost of RCT, which comes out to around 40,000. A blackmail kind of a thing, maybe. Now the actress is guilty on this count. So we denied her the compensation. She decided to go public with this incident 23 days after it had occurred. Now, she told us the swelling will cause her to lose her job, which we offered to give her a medical certificate which advised her to take rest for 20 days until it heals. I'm sorry, he cannot issue a medical certificate in this regard, for a bed rest is pleased. That is against the DCI rules. What more can I say? Even that is limited to oral surgeons for any surgical procedures. However, she rejected the offer and publicly asked people to downrate my clinic on Google. And fans and emotional followers, we all know what they can do. Within the span of 1 hour, my 5-star rating went down to 1-star rating. I had to take my clinic and address off the website. The damage was done. He could have dealt with this situation a little better. I've suffered a lot mentally because of what has happened. She'll claim that she has suffered worse than him, sorry, in that. I did not want this to become a big situation, but if she decides to take the legal route, then I will do it as well because I have all the proof I need. He says so. I'm not really sure. There has been no mention of those things. Now, the actress says the mistake has cost her almost everything. I lost my job, lost my orders, lost my contracts for modeling, even a few TV serial offers, as well as movie offers. And one of the news also reported that she has one movie ready and she was supposed to begin the promotions for that, which might be delayed because of that, which might suffer financial losses, and the producers might actually take him to court for this, that she has been delaying it. She was asked, as usual, by the media, hungry, frenzy media, you can say publicity hungry. Will you be taking any action against the clinic? She says, I will let you know soon. Now, this is both the versions and in short, the story and the synopsis of this. I've already told you about the statements. We have to be very, very cautious in what we say. We hardly have any communication etiquette in that regard. We don't use our words very carefully. Especially the second opinion dentists, sometimes they tend to go overboard. We get fancied. We treat Indian celebrities, Indian actors, Indian cricketers, Indian politicians as God is cute kind of a thing. उनके साथ आधे तो पहले एक सेल्फी लेते हैं हम और प्यार प्यार में हम सब कुछ अपने सीक्रेट्स खोल देते हैं. Of course, every trade has its secrets. It does not mean that they need to be divulged to everyone. So let's do the analysis of the case first. Then we'll do the legal and the social analysis, of course. So let us see what it can be, what this swelling can be. Possibility, the first possibility is it is an hypoextrusion accident, hypochlorite sodium hypochlorite, or an extravasation into the tissues. Maybe a phoenix abscess, maybe a hematoma, because there was a mention that in one of the news articles also that maybe she was injected with hypochlorite and not LA. Many clinics, this incident has happened. In my initial career, I was working in a hospital. You can say one of the colleagues wrongly injected hydrogen peroxide or hypo, I don't remember, but either of the two injected in the place of ESA block. And the patient had big swelling within 5 minutes. And I'm talking of the year 98, 99, almost 24 years back when I was working as a fresh colleague and fresher dentist in my first jobs in GTB hospital. I've seen those things live, wrong injections sometimes because sometimes people have done it. Their assistants are new. They don't know that the hypo syringe sometimes has to be bent. And of course, the LS syringe doesn't need to be. We don't make such segregation. Sometimes inexperienced assistants do make this mistake. Then probably space infection, quite possible, cellulitis possible, and iatrogenic or pathological flare up, maybe, yes. We don't know the history of the case. We haven't seen the preoperative X-ray. There has not been a mention of the preoperative X-ray also. If you have been watching my lives regularly, I've discussed the cases where preoperative X-rays, the other factors have come into play. Now, this is one case scenario which caught my attention because in this, everything other than those cases which I've taken up in the past in episode 17 and 20, they have come to the picture rather than those episodes, the things which were there. If you thought those episodes were the end of the world in the terms of legal scenario of the root canal cases, welcome to the new reality. This is the new reality. Over instrumentation, cellulitis, of course, all these can be possibilities. Most likely, it is an hypoexclusive in my case, going by the looks, of course. Now, the statements of the actors have mentioned salicylic acid also. I was injected with salicylic acid. The first thing is it is not usually available in liquid form and it is not found in majority of the dental clinics. Unless the same clinic is using hair and skin transplant and skin cosmetic and botox and everything, where there might be the salicylic acid is might be used as a chemical peel kind of, which doesn't seem to be the case scenario. Still, we don't know whether it is a skin care as well, which does not seem to be the case right. So where does the salicylic acid come into picture? We don't know. It might have been like that sometimes it does not go into that situation. Now let's explore this is about the case analysis. Let's explore the legal angle in this. So the actress has already given a hint. Indeed, the burden of truth, the burden of proof lies on the plaintiff to prove her case. The burden of proof means the one who alleges he has to prove, he or she has to prove on the plaintiff. Plaintiff means the complaint in the legal language. So the burden of proof lies on the plaintiff to prove her case that the doctor was at fault. Of course, the courts are not competent enough to decide, so they always refer it to an independent dental board as well if it goes to court. And there will be team of specialists involved. We saw in the episode number 17 and 20 the case which happened in Hyderabad, Telangana. So not necessarily all of them might be endodontists. And in that case scenario, if you remember, the judges have picked up the minor opinion. Three people were there, two gave the clean chit. One was saying, the neighboring dentist was saying that maybe he or she was not at fault or was at fault. Sorry, personal enmity, neighboring dentist. We don't know the reason, but yeah. And the judges picked up that. Of course, as I detailed in there also, it was a biased thing. Now, one thing the dental board will examine would be the documentation. They'll check and resort to that. It is a standard gold. You can say it is a gold standard which has been there. The Bolam's test, we all know. I have explained various consent videos as well on my YouTube channel. So you all know it. The most surprising thing is that none of the parties have made any reference of documentation so far in any of the news. And by far now, I will believe that the media is already trained on these things more than many of us, that they will pick up this point. Unfortunately, they haven't. Even the dentist has given a reference of the videography only, which I believe is nothing but a CCTV footage with mic, without mic, which may not be conclusive. Of course, it has to be proved by the complainant only. But when the board gets involved, and if it is a hypo accident or anything similar, no reference point has been made for consent. No reference point has been made for rubber dam. No reference point made for root canal specialists doing it or not doing it. Whether Dr. Mayuri Sanjay is an endodontist or not, or probably whatever. I'm not saying it is a mandatory thing for the endodontist, but going with the past case scenario which we have dealt in the episode number 17 and 20, and before that also, there are so many more angles which come into play. So a speciality thing, all these things, because we are all constantly walking the line of fire. Along with legal angle, of course, there is a big social media angle also. which the dentist has already tasted. He's within 1 hour he's gone down from 5-star rating to 1 star. There will be a media trial which will go on biasly. I say it in a non-shameful manner. It will go on biasly against the dentist for sure. Wherever healthcare professionals are involved, the media is always. So dentist case जीते ना जीते वो तो बात win or loss is always secondary in these situations. What he has suffered already and will suffer in future is the reputation which matters. Consent becomes your biggest savior in such cases, especially if you have diagnosed it pretty well. You expect infection, you expect some swelling, you expect something. There might be, of course, a proper skill is required in using hypochlorite, using precautions in the form of rubber diamond, all those things. So all those things are necessary, no doubt about it. We cannot escape those things. But the problem is, case goes much later. It'll be a social media frenzy will be created. Since Swathi Sathish is a social media celebrity, the first thing she's already done that she'll further post when she might see the game losing out of hand or going out of hand. Maybe a little bit. This is a human emotion. We all try to react back. She may post on social media, of course, to get sympathy. She will complain to media and newspapers and will get publicity, which is their primary fodder, of course. She might create a hype out of the situation to blame doctors, which many of us are already on tenterhooks. Then she might incite vandalism. I'm not saying she'll do it. This is a possibility. Indirectly through her supporters by physical damage or injury to clinic, or maybe enragement or a crybaby. So the problem is this: in India, we don't choose our heroes wisely. So there has to be certain things which have to be taken into account. So this was the topic for today's session. The actress Swathi Sathish. Is the dentist really at fault? We don't know. But yes, a couple of things are dodgy, which are debatable. Is the actress really suffering? As per the dentist, she is not. After the initial phase, she's already healed up well, but just she's trying to make up for the loss of the time. Again, we don't know the real truth. There are quite a few things which are against the dentist, against the actress, of course. So what is the real truth? It might surface in the few days to come. So the debate begins and is open for all of us. So what is the carry home gyan for all of you? It is going to be a long war. They're going to go the legal route. One thing is for sure, there will be no easy choices for both of them. So arrogance and ego will have a big role in this for sure on both the sides. We actually don't know what transpired between the patient and the clinic in terms of communication, in terms of consulting, in terms of warning, in terms of consent, in terms of documentation, in terms of procedure, in terms of skill, in terms of knowledge, in terms of whatever the patient was dealt with, in terms of post-operative care, in terms of the facilities offered, in terms of the diagnosis, in terms of the explanation of the facts. There are, in terms of so many things which I've just mentioned, they all can be decisive in the court. And the second opinion scenario, whenever it comes into picture, is used as a manipulation scenario. That doctor told me, because many of us, as I said, we get celebrity in my clinic, and we start spilling out our trade secrets. Of course, I'm not saying something wrong or good in that, but there is a certain line which we don't need to cross, because many of us lack our basic communication and consultation etiquette. And I say it unshamedly. This is a fact. We get overawed by celebrities visiting us, and our primary objective is to selfie ले लें पहले. Social media पे डाल दें. Wow, this dentist is a big fan. This dentist is a big follower. He's having selfies with every known actor and actresses. We can easily speak against our colleagues without even understanding the consequences that one day fortunes and the roles might be reversed. One day the tide can reverse against us also. We are also human. This is quite a bit of possibility. As they say in the this was in the very recent Akshay Kumar Rajnikanta ad. So maybe it was an Elaichi ad, but we all know what they are selling actually. So choose your heroes wisely. People are promoting gutka and all those things, so that is the reason. So India film star, politicians and cricketers are akin to God. We forget they are also human like us and don't deserve special God excuse status that we give. This is the only country where they are doing it. In you can say in foreign countries, in Australia, in UK, sometimes the presidents and the prime ministers are also traveling, respectively wherever applicable, are traveling in the local metro and the local trams like normal people. We have made them into a goddess status, and we need to evaluate why, why and where. Is the treatment really gone wrong? So there have been social media frenzy. You can say Dr. Mayuri's story, Dr. Dhananjay's story, Dr. Miss Swathi Sathish angle. Who is at fault? Who is not at fault? We'll know in coming days, of course. So moral of the whole story is the medical procedure have their own risks and complications. Only the treating doctor. We should not make a judgment immediately about our colleagues, because I always say there is nothing wrong or right in this world. It is only the perspective which matters. Sometimes the person on the other side knows why he did that, and how he did that. We only can make assumptions and suppositions, and those both of those things, assumptions and suppositions, are dangerous. So it can happen with anyone and can be managed without any fear and morbidity. But what we don't need, and which is usually done without we even needing it, is the social media trial. It is a fast-paced world, and we all get undue attention. And colleagues only tarnish the image of profession by speaking against each other. There are so many angles which have yet not come into the picture, which were there in the previous case. There are the new angles have come into this. So we have to be responsible and ethical while speaking and posting socially without seeking any publicity or attention. We need to choose our heroes wisely. We need to develop a consultation and a communication etiquette. We need to diagnose well. We need to don't start in a hurry. We need to have our documentation as impeccable. We need to have consent forms in place. We need to tell the patient about the RBOs, risk, benefit, and options. We need to have a communication one-to-one proper, so that both of us are on the same page before we start it. And once we are on the same page, trust me, guys, anything that happens can be managed very easily, because the patient is not in for a shock. It is only the shock which creates the situation, because the courts have always said it. The patient has to make an informed choice. If somebody tells that the preoperative condition shows that maybe there is an infection chance, let's suppose it is not an extrusion accident. Let's suppose it is just you can say a cellulitis or a space infection kind of thing, which maybe got flared because of maybe a small instrument going in beyond the apex, which is quite likely. So if the patient has been warned that there's already an infection, there might be a resultant swelling, the patient will make a choice whether I opt for the treatment or not. In those cases, the patient again is warned. Even in cases of no treatment, you may end up in a similar situation in a few days. So the patient is in a consistently correct position to make a choice, and that is what matters. And that is what is important in the law of consent, which unfortunately many of us don't resort to. We still resort to blanket consents or the IDA website consents. Those are not consents. You don't need them. They are not valid in any court. So kindly try to understand the word is a customized, written, informed consent. Whether you want to believe it or not, it does exist. And of course, don't need to say further on that I am doing these things, but never mind. So I hope I have put your brain in the think mode, and the light bulb has awakened you a bit. So if I've disturbed you, again, my favorite Japnam. Thank you so much for a patient hearing. And this is the WhatsApp group community that I'm running. Of course, this will be shifted to 512 format very soon by the end of June. I'm just keeping things notified the group, given them 3 weeks margin. So if you want to be added, these are advertisement free groups where my own workshops are also not promoted. You can send me a message on my cell. I'll add you in the group. So this is my YouTube channel. If you are not aware of it, go to YouTube, search Dr. Hardeep Ahuja. As on 10th June, 485 plus videos are already there. And yes, of course, 7-8 videos new coming by the next Thursday with sure. Do send me a valuable feedback on my phone, on my cell, on my page, on my YouTube channel, wherever you watch it. Bouquets and big baths both would be welcome equally. Thank you so much once again, and I stop my share for questions, if any, from all of you, and acknowledging the visitors on my page where this session is happening live. So, hello, Dr. Sonia Tina. Good evening. Hello, Dr. Shikesh Telu. Hello, Dr. Parul. Hello, Dr. Ramchandra sir. Hello, Dr. Prateek. Hello, Dr. Raghu. Hello, Dr. Virinda. Hi. Hello, Dr. Sanchit Paul. Hello, Dr. Nisha. Hello, Dr. Sneha. Hello, Dr. Jaswant Singh ji. Hello, Dr. Manuji. Good evening. Hello, Dr. Taul Hafiz Imran. Hello, Dr. Krupa Santosh. Hello, Dr. S.P. Singh, sir. Hello, Dr. Mukesh Mittal. So, I hope this episode was of value addition in some way or an eye opener for all of you in some way or the other. As I told you, the next episode of Miraculous Monday is going to be uh, an hour long episode, and it will not take place on Monday but on Tuesday. Since it is a event, it is a, you can say, a celebration in my family on Monday, 27th June. So it will be taking place on Tuesday, 28th June. It will not be half an hour, but a 1 hour long session. And of course, I'll notify in the WhatsApp group. Tentatively, it will begin around 8 only rather than 8:15, 8:20. It will begin at 8 only and end around 9:19 or so, maximum. So I'll take up a lot of questions in that regard. So tomorrow is Thursday. We meet for the 25th or the second last episode on the Thunder Thursday series, which also ends with a finale next week. And again, that takes place on a Wednesday because Thursday is 30th June, which is my late dad's death anniversary, which is I have rechristened that day as Mini Day of Education. There will be webinars separately on that day. I've planned for that day, but the Thunder Thursday will be preponed and taking place on Wednesday. Of course, I'll notify in the WhatsApp groups. So if any of you watching are not in my WhatsApp community, please do let me know. I'll add. So thank you so much, guys, for watching it. I can see Dr. Dhruvi Joshi. Hello, Dr. Dhruvi. Hello, Dr. Parul. Thank you. Hello, Dr. Dhagash. So thank you, Dr. Ramchandra, sir. Thank you, Dr. Sonia. So let's meet tomorrow for Thunder Thursdays penultimate session, episode number 25. Bye bye. Take care and have a great